the first exercise that we're going to take Dustin through today is going to be a phase 1 exercise. We're going to do ankle pumps, but we are going to avoid having him dorsiflex and evert. So like similar to a Kliger's test that is used to actually diagnose a syndesmotic ankle sprain, we're not going to want him performing those movements right away. So at first I'm going to have Dustin flex your toes, so point your toes to the floor. Very good, and then bring it back up, and then bring this side of your foot in. So for the first phase, we're just going to have him plantar flex and invert, and then we'll move him up to a band. And then before progressing to phase 2, we want to make sure that he's doing all 4 motions, so plantar flexion, dorsiflexion, inversion, and eversion. We want pain to be pretty minimal, so nothing above a 3 on like a 0 to 10 pain scale here. To start, we'll have him do like 2 sets of 8 and then work up from there.
So because our patient went through surgery to repair their syndesmotic ankle sprain, we want to get their joints moving as best as we could because they were immobilized. So one way that we can do that is apply a anterior to posterior glide of the talus, which is what articulates with the tibia and fibula. So there's different ways that we could do this. One way would be applying force on the tibia against the talus, but because they were just out of surgery, it's probably going to be really painful if I were to be pushing this way and doing an opposite force. So what we're going to do is switch it up. Have most of my force on the talus, so right below the tib and fib, and applying a posterior force or stabilizing force on the back side of the tibia and fibula. So I'm just going to be oscillating back and forth. This should be no pain. I'm just getting a little bit of movement, and as we get better, we can go through different grades of mobilizations and increase. So right now I'm just doing tiny oscillations. I'm not even going to the end range of the joint. This is just for pain modulation and regaining that joint mobility.
So we're going to start with some phase 2 exercises, and one of them is going to be a single leg balance exercise. We want to try and increase stability and proprioception, and by increasing proprioception, it helps increase stability and decreases the likelihood of re-injury. We should see some muscle contraction, but there should be little pain, about 2 or 3 on a pain scale from 0 to 10. So to start off, our patient's going to have their shoes off, and they're going to balance on the one leg, hands on their hips, and they're going to balance for about 10 seconds. We're going to do 2 sets to start with, and we want to try and increase up to getting 3 sets of 30 seconds. So another phase 2 exercise we want to have our patient do is heel raises. We want to try and keep a conservative approach as we move forward. So we'll start with stabilizing the table, and it'll just be a double leg heel raise. We're going to start with 2 sets of 10. There should be some pain, mostly when our patient is trying to control down because the talus is pushing on our syndesmosis.